Hello everyone, welcome back to TimesXP. I am Dr. Isha Soni, the co-founder and center head for Lexicon Rainbow Therapy and Child Development Center, Pune. Today, we are going to continue our series of autism and talk about why should one take treatments for autism when there is no cure to it. So, the scientists have not exactly found the exact cause of autism, and hence there is no sure shot or 100% cure for it. But as seen from last 2 decades, therapies have certainly helped the children come a long way. It is often recommended to parents to begin early intervention as soon as the child is put on risk for autism. By doing this, the parents are actually helping the child meet his milestones and bridge the gap between his current performance or milestone attainment and what is expected at his age. So, if a child is starting speech therapy, we see an increase in the expressive language of the child versus if the child does not undergo this, it will lead to more and more negative behaviors from the child, as the child will get frustrated by his inability to communicate what he or she wants from the parents. It becomes a very difficult and challenging condition for both the parent and the child. Many times in speech therapy, a child is also exposed to alternative and augmentative forms of communication. This means uh, therapists often recommend using picture exchange communication system. Science and evidence also shows that using this AAC method actually gives a speech burst to the child, and there is a reduction in negative behaviors because the child is able to get across his message. In occupational therapy, the occupational therapist works on the motor skills of the child. In this, um, it helps in the overall development of the child. Many times it is seen that the child comes across as very lazy or is not able to sit, or it may also happen that the child is very hyperactive. So, in either of the case, the therapist develops a proper therapy program or a sensory diet for the child, which is inculcating the activities in the daily routine of the child such that the energy of the child gets channelized. Also, the occupational therapist will work on the posture of the child. That will help the child to sit better. If the child is sitting better, the attention also improves and it helps the child in the other therapies that the child does. In special education, the cognitive concepts of the child are being worked on, and also it helps to increase the sitting tolerance. All these things which the therapies help to improve will directly have an impact on the day to day life of the child. It is extremely essential for the child to sit and listen or to talk when the child goes to a daycare or school. Hence, what we are actually doing by doing these therapies are improving the quality of life for the child and for the family, leading to their mental well being. Thank you.